Welcome back to Daytime. In case you are just joining us now, we are on the other side of the set because the new set is being installed as we speak. All right, back to what we're talking about here. We have our expert panel of doctors here to talk about what's buzzing in the medical community. Dr. Srinivas Iyengar is a cardiologist, Dr. Jill is an OBGYN, and Dr. Adam Scheiner is a cosmetic surgeon. Welcome to all of you.
Great to be here.
I love the doctor panels. Yeah. All right, let's start with back to school. Vaccinations are a hot topic, and with some parents adamant that they will not vaccinate their children. What should parents know going into this school year if you know that there are some kids that are not vaccinated?
Yeah, we were talking about this. I think the idea that there's this anti-vaccine movement in terms of medicine, it's really, there's no real science behind that, and our kids need to be vaccinated. It's really important.
Honestly, Cindy, I believe patients should have choice in healthcare. They should always have an option between two. This is the one area of healthcare that there really shouldn't be an option. We should be vaccinating all of our children.
And you know, as a father of a 3-month-old, I'll tell you right now, my daughter's getting her vaccines. So there's no doubt that I believe in the actual science behind it. And again, there's going to be people out there who won't want to vaccinate their child. But the way I look at it, and Jill put a great point, why endanger other individuals, immunosuppressed people out there by not getting the vaccinations?
Would you feel comfortable enrolling your child in a classroom where you knew that some of the kids were not vaccinated?
I would say no, because I think in totality, the vaccinations prove that society can be better off if everyone does it. And the fact is, the science does support it.
So I think there might be more homeschooling in our futures because of this.
Well, you know, California, they just passed this law, and they said that the kids have to be vaccinated. There's no more religious exceptions or personal exceptions. Now, if there are people who are immunocompressed, then they maybe don't have to have it, but there's this idea of herd immunity where we have to have most of society immunized, and that protects those other people that can't get vaccinated.
Exactly.
Right. Okay. All right, let's move on. A gynecologist at a Waterbury, Connecticut hospital was fined $5,000 after removing the uterus of a pregnant woman who said she wasn't pregnant. The medical examining board ruled Dr. Jonathan Foster failed to notice the patient was pregnant before performing a laparoscopic hysterectomy in 2011. How does this even happen? Instead of conducting a preoperative urine test, blood test, or ultrasound. So is this fine justified? I think it's worse than he shouldn't have a license anymore after you do something like that. Thoughts?
I think we need to know a little bit more of the case. I mean, ultimately, from what I've read, he was deserving of his fine because we never go off what the patient says. We have to make sure that you back that by medical science. We have the capability to do testing to ensure that they're not pregnant. That really needs to be done. And of course, you know, the standard of care per community warrants that you should do a pregnancy test on any woman who's of childbearing age.
Adam, go ahead.
I was going to say, in my OR, because I do surgery, you know, we always check people who are childbearing age with these tests before we bring them back to the operating room. I think it's the one place that he may have fallen down, because it did say that he tested a couple weeks before. But maybe that little bit that he fell off, he deserves the fine. I don't think his license should be taken away, but I do think that he should have that fine as a learning point so he can do better in the future.
Yeah, and Cindy, we're basically sitting here knowing a brief part of the case, and there's a lot more to it, obviously, but yes, we have to look at this from the patient's perspective. As physicians, as proceduralists, as all three of us are, #1 priority is do no harm.
Right.
So we have to keep that mantra in mind.
I'm thinking the fine of $5,000 is just the tip of the iceberg. I can see a lawsuit here definitely in the millions. Can't you?
There could be, but remember, she was going in there to have her hysterectomy anyway. Who knows what she would have chosen if she had known or not known. So.
Oh, good. All right. Okay. Detox diets are all the rage, like the Master Cleanse, Smoothie Cleanse, or Juice Cleanses, just to name a few. All right. I know that there are different people who have different opinions on cleanses. Dr. Iyengar, should we cleanse? Do we need to cleanse? Is there any benefit to this at all?
Well, you know, researching this topic and talking to a number of individuals who do detox, there is something I think called the placebo effect here. A lot of individuals feel much better after a detox, but science doesn't back the evidence. There's not really a lot of support saying detox cleanses or diets really work to do anything. And the fact is that we were talking prior about if people are eating a lot of artificial sugars or a lot of fat, yes, you may be able to get rid of it, but it doesn't start with a detox. It starts with not eating it in the first place.
Right.
So that might be the most important point about that.
Jill, do you see any?
I mean, I think that it could be used potentially as a jump start to get your diet going, but ultimately that's not going to help you lose weight. You really need lifestyle changes.
Right.
So, and they do tout that, well, you'll feel better on your detox diet, but really, I think you're probably feeling better because you're not eating processed foods, wheat, gluten, all of those things. I think that probably plays more of a role.
And I know a few people that don't feel better at all when they're on it. They just feel hungry and angry.
Right, and
Angry.
Right, this is one issue. There's a lot of pseudoscience out there, right? And people, these ideas of detox. Well, we do have a kidney, we have a liver, we have an intestinal system that does a great job of taking, toxins out of our body. So I agree. I think if it jumpstarts a healthier lifestyle, that's great. But otherwise, I think the better ways to lose weight are vegetarian, sort of low-fat diets or low-carbohydrate diets. Different patients will do better on different ones, and really it's up to the patient to do that. But I think lifestyle choices are much better than these detox diets.
And really quickly, the weight that they lose is usually water weight, right?
True.
Exactly.
So
Diet and exercise, diet and exercise, diet and exercise.
can't say it enough. Okay, we've got more to talk to you about. We'll be right back with all our doctors right after this. We are back with our doctor panel, Dr. Iyengar, Dr. Jill, and Dr. Scheiner, and we've got some really great topics, and I want to get your thoughts on all of them. Spurred by falling sales and consumer safety concerns, PepsiCo, North America Beverages, announced that an aspartame-free diet, Pepsi, sweetened with sucrose and Ace K, will hit shelves soon. Ace K, I wonder what that is. Okay, is aspartame dangerous? Because we have a lot of it, and we've ingested a lot of it. Thoughts?
I mean, aspartame is equal. And that's what I tell my pregnant patients to use when they're using sugar replacement. So I think that aspartame in general, I mean, unless you're drinking 50 Diet Pepsis a day, you're probably safe.
Okay.
Yeah, I think that really the issue is if we on one end of the spectrum for liquid beverages, we have water, and then we have sodas with sugar in them. Well, interestingly, even apple juice has as much sugar as some of these sodas. Sugar is actually more damaging to us than this little bit of aspartame that we're talking about. And the diet sodas really fall almost toward the water side of things. Well, I don't think we should do things out of moderation, but yeah, I don't really have an issue with the aspartame.
What about sucralose and Ace K? What is sucralose?
Well, the thing is that you're talking about sweeteners. And Cindy, the thing is what we really need to talk about are diet sodas or Coke or Pepsi, of that matter, any good at all? And the answer is no. They have no nutritional value, zero. So the fact is that right away we have to say, forget the artificial sweeteners, take the whole package. Why should we be drinking these things in the first place? Remember, we said diet sodas can stimulate hunger, and actually you'll reverse that. You would actually increase your diet with diet sodas.
Right.
And again, sugars in the sodas themselves are terrible. It's really no nutritional benefit from any soda. So other than the artificial sweeteners, it's the whole package is not good for you.
I think it's kind of weird too that they're all of a sudden doing this. They're caving to a 10% drop in their sales. I think they're trying to spur their sales up, but I think it has nothing to do with the aspartame. The drop in sales has to do with better other choices of beverages.
Okay. MMA fighter Kimberly Noveas made headlines when she won a title fight while unknowingly 12 weeks pregnant. She found out she was pregnant at 24 weeks. Is it safe to do sports or MMA when you're pregnant?
So obviously, I tell patients when they're pregnant to always keep the same exercise program that they were doing prior to being pregnant. But there are some exceptions. An example would be that MMA fighter.
Right.
They're getting tousled around, punched, kicked. It's just not ideal. In her case, she really didn't know she was pregnant. So in fairness to her, she wouldn't have done it probably if she had known. And luckily for her, she was only 12 weeks. When your uterus is that young, up to about 14 weeks, it's really kind of protected by the bony pelvis.
Okay.
And so she's probably okay. But once she finds out she's pregnant, she really needs to stop.
Stop the MMA.
Exactly.
Workout, sure.
Yeah, I think punch to the belly, no.
yeah.
Definitely no.
Right,
You know what?
I mean, surfing, trapeze, circus, trapeze, I mean, why?
do that.
Why would you risk falling? Your balance is off anyway. No.
Right, and I think when she found out she was pregnant, she actually stopped
yes.
wrestling. And so,
What about running?
That's
she should be
safe.
running. I think it's
All
just
the way.
fine.
I know
All the
some
way
people
through.
have run
Marathons, I've seen,
while
yep.
they're quite pregnant.
I think there's extremes to everything. I mean, I think that's an extreme as well. You know, running a marathon to prove a point with a pregnant doesn't make a lot of sense.
Okay.
Why dehydrate yourself?
Exactly.
Exactly. All right, singer and actress Leanne Rimes raised eyebrows when she recently revealed that she takes 40 vitamins a day, and that includes prenatal vitamins. Is it safe to take that many vitamins? And are prenatals necessary? I mean, obviously she's trying to get pregnant, but 40 vitamins?
So we have a little disagreement. We actually talked about this before. We're a little bit on different ends on this, but I'll first say anybody that takes
she's not trying to get pregnant.
She's not trying to get pregnant.
Well, I thought she was trying to get pregnant. Okay.
But I'm okay with her taking them. So this is where we differ. So I feel that a prenatal vitamin is a really good supplement. Obviously, their concerns are going to be that it has a higher iron content and a higher folic acid content, which could be a concern. But for the majority of women of childbearing age, you sometimes don't know when you're going to get pregnant. So if you're on the prenatal vitamin, it helps keep your stores up so that you are ready in case you get pregnant.
And I agree. I actually think this is a soft call saying that, yeah, taking too much of a prenatal is negative, but their iron can store up in your body and lead to constipation and obviously zinc deficiency. And there's issues with too much iron if you're not trying to get pregnant. My main issue with Leanne Rimes right now, though, or anybody of this sort, I see these patients daily who come to the office who refuse to take one prescription medication from me, but they will take 40 supplements.
Right.
And I ask them, give me the cost benefit. How much does this cost? And they will tell me numbers, $100,000, $1,000 a month, whatever, that costs more than the prescription.
She has the most expensive urine in the toilet.
Exactly.
Because it's all coming right
I
through
bet
her.
it's glowing, too. It must be very bright.
Right, they've actually looked at this. The U.S. Preventive Services Task Force actually looked at vitamins, and they looked at whether it has an effect on either cancer or heart disease. And actually, with all the evidence out there, there's nothing strong that says that it recommends it. And interestingly, for people who smoke, having more beta-carotene can actually be dangerous to them. And so, yeah, with these prenatal vitamins, I would prefer if they had just the folate, right, and not the iron, if they could have that. But yeah, I think things in moderation are really important.
What are your thoughts on vitamin D? Because for a while there, that was what everybody was touting.
It's the du jour. It comes and goes with the wind. You know, one day it's the best vitamin out there, next day it's been debunked. And just like we've been mentioning, that I think at the end of the day, nothing is a panacea. There's no cure-all vitamin. I think your diet, a healthy diet.
Right.
We keep hammering the old-fashioned diet and exercise.
You shouldn't need a vitamin.
You shouldn't need a vitamin. Well, unless you're trying to get pregnant, you shouldn't need a vitamin if you're eating a healthy diet.
But I'll say one thing. For people who have a lot of darkness to their skin, they don't get as much vitamin D. You can check your levels. And for those people, actually, there are people who have low vitamin D, and that is important in our body. They really do benefit from having supplements.
All right, docs, thank you very much. Good advice. Jill is going to stay with us and talk about a very important screening a little later.
Genetic testing.
Yes, good stuff. Thank you all very much.
Thank you.
We'll be right back.